I'm Wong Keng Man. I've been practicing prosthodontics for the past 12 years. My role is actually to reconstruct patients' smile. Actually, when they have problems with their teeth or they have missing teeth, we will try our ways to actually try to come up with a plan to put the perfect smile back onto them.
I'm Dr. Ang Chi-wan. I've been practicing periodontics for the past 6 years. The role of a periodontist is to first diagnose and treat gum disease. In certain cases, we also reconstruct gums and bones that are missing in order to create a nice canvas so that the teeth can really show through in a most natural possible way.
I think the philosophy of our office started very early. When I first came back from the States, maybe 10 years ago, we actually have this concept of restricted to our specialty of practice. So I was practicing in a much smaller place, right? And later on, I realized that dentistry should not be just one specialty, because the patient may not just need prosthodontics. So we decided that maybe it's good to get like-minded people, like Dr. Ang himself, to be part of the team. Not only him, we actually have a big group of people. So that every patient that comes in, they're all more integrated, right, in terms of treatment, multidisciplinary. But it's not easy, because from a small practice, way back 10 years ago, we expanded to a 4-chair practice, and eventually now we have, currently we have 14, and we are extending it into 18 chairs. Why are we doing that? Because I think patients today actually look forward to coming to one place and have all the treatment being treated.
In T32 Dental Center, our philosophy for the patient has always been to empower them with all the information they need through education. So we have many different forms of information that patient can access, like educational brochures, the website, and we always believe that the first visit should never be for treatment. And in the event that you rush into treatment, a lot of times, the patient and the dentist do not have enough time to discuss. Expectations are never met, in this particular way. So we spend a lot of time in the first visit telling the patient the pre-existing conditions they have, and if they need to treat and save their teeth, we will arrange for that to be done first. And we spend a lot of time explaining to them the differences in the type of implant materials they can use and also the cost involved. And only after that do the patients really go back and think through before coming to a decision whether they want to have a particular treatment done or not.
Maybe now we can actually bring you all to show you all what we mentioned earlier on. Let's go. So,
this is our reception area. So patients, when they first come in, they will be greeted by our receptionist, who will then direct them to the lounge. This way, please. So in this area, patient can have a drink or something to eat in a nice, spacious area. In our center, we have about 14 rooms and 2 surgical suites. On your right here, you can see there's a consultation room. This is one of the 2 consultation rooms we have. In the consultation rooms, the patient will be given a very detailed explanation of their condition, materials that they can select from, and also importantly, the cost of treatment and the duration of treatment. All this will be discussed in a comfortable area of the consultation room rather than in the clinical area. Clinical room, there will be the monitors for a patient the dentist can discuss their x-ray findings with their patients. We also have intraoral cameras where a patient can actually see what's happening in the mouth. This is our sterilization room. We adopt an open concept so that patients, as they walk past, they can actually feel assured, because they can actually see what we do with our instruments, and all the instruments are clean and autoclaved using the right protocols. This is our CT scan room, the second of our X-ray rooms. In this room, it houses the 3-dimensional cone beam CT, again, being digital, the radiation dose is a lot lower than conventional medical grade CT scans. And moving on, we will approach the surgical suites. This is the main surgical suites. In our surgical suites, we only do surgeries because we want to make sure that the potential cross-contamination from other procedures will not happen in our surgical patients. And in our surgical suites, we have equipped it with the surgical lights so that the surgical area can be well illuminated. And also we have a camera that's attached to it, and this will allow us to do training courses, live surgeries. And besides that, we have invested in a microscope where the surgeon can actually magnify the surgical sites to up to 15-20 times in order for the surgeon to do very fine surgical work. Let us proceed on to have a look at our in-house laboratory, where the crowns, bridges and dentures are being created by our ceramists and technicians. This way, please. This is the place where our technicians work, and where our dentures, our crowns and bridges are created. Being in-house and in close proximity to the clinical areas, the dentist will have an opportunity to directly tell the technician the color, the shape, and the different features that is to be built into the crown so that every single crown will be individualized. This is our auditorium. It can house up to 50 people, and in this auditorium we use it for two main purposes. One of them is to conduct public forums for the layperson, the patients, for them to get enough information about whatever treatment they need to do. And also we conduct courses for fellow dentists using this auditorium.
So from a patient standpoint, it's like, wow, today dentistry is so much different from the past. And I can tell you that a lot of our patients that came to our office, they are impressed by today's technology. But like I say, there are so many technologies coming out. We are now, as professionals, trying to see what we can choose to benefit the patients. I think dentistry today still need the professional diagnosis and treatment planning. We still need to upgrade ourselves in terms of technique and surgical skill. And finally, material selection. That is all evidence-based. I think with that, in totality, our patient can benefit with a safe, with a security feeling that they are safe.